to our health correspondent, Nicola Hill, who's joining us from London. Good afternoon to you, Nicola. So the British Prime Minister is holding a meeting of G7 countries. What's he going to ask his fellow leaders to do?
Yes, Kamali, what he's going to ask or suggest is that everybody should give away most of their surplus to these countries. It's like you said, you know, the top 10 countries have got more than half of all the doses of vaccines, yet they've only got 13% of the population, and 130 countries have got no doses whatsoever, which is quite shameful, really, isn't it? So Boris Johnson is suggesting that countries should give away most of their surplus. Now, it's interesting to say the word most of their surplus, because obviously he's intimating that they want to hold some back, stockpile some of it, in case booster doses are needed later in the year. So why have they got so many? Well, obviously because they're wealthy. These countries were able to put in orders for many of these vaccines that were being developed very early on in the development process. They didn't know how effective any of these vaccines were going to be. So as an insurance policy, they ordered millions of doses of each of them. And to everyone's surprise and pleasure, of course, most of these vaccines are effective, certainly against the original variants of the virus, and that's why there's so many. I think Canada has enough doses to give its whole population 5 doses each. The UK 4. The US has got enough to give everybody 3 jabs, which is way more than is necessary if most of these vaccines are a 2-dose, or with the J&J one, a 1-dose vaccine. So we've got many of these charities saying that this is morally unethical and we need to share the vaccines much more. We've got the CEPI organisation, so Dr. Richard Hatchett from CEPI, making the point that basically, you know, as you said there, we're not safe until we're all safe, and that we definitely need to delay the transmission of the virus. The only way we're going to suppress the transmission is by ensuring that everybody is vaccinated, and that's what needs to happen. There has been speculation, I've been looking on social media, with some people saying it's like being in a plane, that you need to fit your own oxygen so that you can help other people, and that implying that basically the developed world should be doing the same thing here. That isn't going to work. You know, we've got to suppress the transmission of the virus everywhere before it mutates. We're beginning to see these mutations. We've got the one in South Africa, which is definitely having an impact on the vaccines. And unless we suppress this transmission globally, the virus will mutate. That's what it aims to do. And there'll be more mutations, and none of the vaccines that we've got will be effective at all.
Nicola, are you getting the sense that there is a will then to share more of the vaccines that are being held in richer countries? There seems to be a push now in the past couple of days, doesn't there, to make sure that it's more equitably distributed?
Yeah, we've had Macron saying that 5% of the vaccine should be shared. We've actually got China and Russia already giving out their vaccines. They're very much gaining the moral high ground in diplomatic stakes here with that. But you have got the charities saying that these suggestions to give away surplus, these suggestions to give a figure of 5%, this is tokenistic. They're actually saying much more needs to be done. It needs to be done much more quickly. So I was listening to the Pan-Africa director from Oxfam, and he was saying that by the end of this year, only 1 in 9 people in that area will get a single vaccine. Contrast that to the UK, where they're promising that by August, every adult will have had at least 1 dose. I mean, that really is shameful, isn't it? And Oxfam were also saying that one of the problems that you have, it's like, you know, what are the figures like in say, Kenya, for example, of how many people have actually been infected? And he was saying that we don't know because even the tests are too expensive.
OK, Nicola, with some slightly worrying news, but hopefully everyone will get the vaccines they need. Our health correspondent there, Nicola Hill, in London.